Hey, we're back. I'm your host, BKP. It's now time for Ask the Doc with Dr. William Whaley. Always want to thank North Georgia Cancer Research Center, affiliated with Northside Hospital. We appreciate them for bringing this segment. We're at Circuit World because we were a little concerned with the weather and might have a little rain on and off all day today, but we'll power through.
All right. Now, I always bring how we're doing in rainfall, right?
Yeah,
I watch the rainfall. Now, last year, remember, we were 10 inches up at the end of the year.
Right.
I told you a few weeks ago we were just an inch up. We were much closer to normal. Are we up or down? We up or down, Josh?
I'd say we're up by a little bit.
Nope, we're down by 0.03 of an inch. That's about as close to even as you can get. It's not raining hard, so maybe we'll get back to normal today.
Well, I will say this. We've had a balance of rain to the point to where the North Georgia mountains are absolutely beautiful this year.
Yes.
Yep. Would you agree? I mean, the balance
and the flowers needed the rain.
Exactly. So it's absolutely beautiful. So we're over here indoors, and we want to thank Jeremy and Circuit World over here for getting everything ready.
Not only that, he has to get up a couple hours early to get in here. Because I pass by here every morning. I know they open up a little bit later than this, you see. He has to get up early to come accommodate you.
He already said, I said, thank you very much. He said, oh, I wasn't doing anything but sleeping. So we got that. So how are you today?
I'm doing fine. All right, you ready to go?
I'm ready to go.
All right. This is a great question. This is a follow-up of one we did a few weeks ago on testicular cancer, I can tell. All right, I'm a 39-year-old male, and I have been diagnosed with testicular cancer. Well, we're pretty sure if it was testicular cancer, it was a male, right? Okay. I don't have any children yet, and he's 39. And I wanted to know if chemotherapy for testicular cancer can cause infertility, and do I have other options? Okay, you got the scenario? So put up that first sign there. I made this real clear when we were at this a few weeks ago. Testicular cancer, this is what they're looking at up there, is the most common cancer affecting men in their third and fourth decade of life. This patient is in his fourth decade of life, at the very end of it actually. He's 39. It's not terribly common. It's only 1.5% of cancers for men. But what's that say right there? Highly treatable and
usually curable.
Usually curable. All right. So this is the part that's not in the question. Testicles have several types of cells, each of which may develop one or more types of cancer. Okay, put up that big old ugly thing so everybody will know what's not in this. They're not supposed to be able to read this, right? So this thing here goes on for several pages, and the only purpose of showing it is that there are crucial questions, crucial parts of the scenario that are not in the question, and that they are. I'll make it kind of easy. We've done the lung cancer thing. We have small cell lung cancer that has a certain behavior, and then everything else I've said is called non-small cell lung cancer, and there are 10 types of it. So small cell has one behavior, and non-small cell of 10 different cell types is different. So the testicular cancers are divided into seminoma, that's semen, that cell, or everything else that's non-seminomatous. So generally, you need to know which of the two it is, because chemotherapy is not the actual treatment for the non-seminomatous and is used in testicular treatment of relatively locally advanced non-seminomatous testicular cancer. Okay. First thing to point out, put up that next one, advanced cancer treatment. So the most important thing to say here is testicular cancer can be cured. It's going to be cured. But the next thing is it's a chronic, it's a sort of an ongoing process. It's a long-term treatment, requires patients to go through regular checkups and follow-ups, and you should have an optimistic outlook at the outset. The actual act of having testicular cancer lowers the motility and sperm count of patients before they're treated. So this patient who does not have any children, before he begins any kind of treatment, we are going to refer him to store sperm and freeze it. Now, my wife knows that over the course of my career, I've had many testicular cancer patients who stored their sperm and then over coming years had children and then would always send us a notice the child was born, kind of grateful because their sperm count may have been very low, the motility may have been low because of the disease, but they were alive. And so then after they've been cured of testicular cancer, let's say they were teenagers and they get married in their 20s, when they take those sperm out, they're not mobile enough to be able to just float up there, and they'd have to be put in by artificial insemination. If they try 2 or 3 artificial inseminations and it doesn't work, what they do is they go and harvest the female egg and they do the fertilization in the test tube and then put the egg back in the mother. So most of our testicular cancer patients, even if they have a reduced sperm count and motility at diagnosis, can donate sperm and can parent. And that really is the crux of this question. He's asking about infertility. Now, do I have other options? And the answer is you should not get into the business. Put up that next one there. It starts with radiation therapy. You should not get into the business with a tumor like this that generally is 100% curable. Think of Lance Armstrong. Remember our discussions about that?
Yes.
He had it in his brain, his lung, his liver. He'd been written off. He went up to Indiana, and Larry Einhorn gave him the new treatment, which I'm going to show in just a minute. Totally cured him of the cancer, and he's back out there now 10 years later, 12 years later now, riding his bike. So this thing will tell you that after the surgical removal of the tumor, which is the start, then they are, remember at the first it says you got to keep coming in and being followed, it said on that slide. They'll bring you back for a scan, 3 months, 6 months, 9 months, and boom, if any of these lymph nodes pop up big in the seminoma, then you get a very low dose of radiation therapy, which generally does not have an adverse effect on what sperm you have. Remember, they were low to start with. But if it's non-seminoma, then you're going to get chemotherapy. So the chemotherapy is it's going to use anti-cancer drugs to kill cancer. It's usually prescribed with advanced testicular cancer, so that's not most of them. And the most commonly used drugs, show that next one that talks about the BEP. I'm not going to worry about the top, which is the regimen, but you only give this thing 3 times. So the treatment is given every 3 weeks, 3 times. That's 9 weeks. So in 10 weeks, even if you've got advanced testicular cancer like Lance Armstrong had in his brain, his liver, and his lung, he's only going to be treated for 10 weeks. During that 10 weeks, he's going to lose his hair. And it's going to impair his fertility. So that's the answer to that question. And that's basically why you have to have a treatment group of people that take care of you that include not only the surgeon, not only the medical oncologist, not only perhaps a radiation oncologist, but a genetic counselor who assists in getting your sperm frozen and appropriately collected, because if you're a teenager, and most of these people, the teenagers are in their 20s, they've got another 60 years to live, and they don't know when they're going to marry or want to have kids. So the most important thing is this question asks, like, I'm trying to figure out about my options. There are a lot of options, but what they really need to be doing is be in the hands of that multimodality group that I mentioned and have those plans explained to them and let them know what's happening to them and why. So we're going to show these next 2. I know that this question came out of that prior question we had a few weeks ago. Show the next one there about the causation. So I'm going to come back to this when we start doing questions. Here's the things that make the risk factors. You'll notice that all the risk factors in this group, except the one that says smoking marijuana, are things you can't do anything about. Age, the fact that your testicle did not descend, your being tall, there's reasons for that, genetics, and race. So basically, testicular cancer is not something that results because you had a bad diet or you were in the sun too much or you smoked. The only thing that would be able to cause it would be marijuana. And lastly, I'll never miss a chance to put up the one about self-examination, if you would. I'll never miss a chance when I'm talking about breast cancer to encourage women to check their breasts when they shower, right? And men don't think about checking their testicles. And remember, that's that guy with his undershorts there. Both of them ought to be symmetrical. Your right hand should look like your left hand, only a mirror image. So your right testicle should look like your left testicle. And if they start looking different, go see your doctor. Is that enough of that?
Yeah, there was a lot of what I would call actually positive news in that, as far as treatment and fertility and things like that, if you follow.
Absolutely.
That's what I get out of that. Okay. All right. Thank you.
We'll stick to that just one more time. One thing about it is, this is one of the places where you absolutely want to be in the hands of people with high volume experience and all of the you got to have relief pitchers, and you got to have long relief pitchers and short relief pitchers. You got to have pinch hitters. You got to have a lot of people to make a baseball team. To make a cancer team, we've said you got to have a surgical specialist, a medical specialist, a radiation specialist, and a genetic specialist. And once you got the right team there, then you let them tell you what to do, and don't try to second guess them.
Got it. Thank you, North Georgia Cancer Research Center, affiliated with Northside Hospital. We always appreciate them for this segment. And we have our second question here this morning. And I did not pull them up on my computer and bring them, so Dr. Whaley, he's pulling me through here by reading the questions. What's our second question this morning?
Well, we're into another one of those. I've been to the health food store, and I got all these people who are looking at YouTube and the internet and telling me what to do. So this one here, I am a 49-year-old female, and I am basically healthy. I have an issue with my blood pressure, and a close friend suggested I take magnesium, but I wasn't sure if it was okay to take with my blood pressure medicines. Now, this patient here has been listening to this program for many years because they are very specific about the treatment. Congratulations on the person who wrote it. I am taking amlodipine and Atacand. I also take other vitamins. Now, this is where I know that they're in cahoots with the health food store people. I take vitamin E, fish oil, and cod liver oil supplements. Is it okay to take these, or would they interfere with my medication? So they've got a really good concept here. I want to do what's right to help my blood pressure control, and I don't want to take something that's going to adversely affect my blood pressure control. So they asked the question about magnesium, so we're going to stick with that for a while, but we're going to come back to the rest of the question in a minute. So show that first picture there. Now this is really easy. It says magnesium supplements can help ease heart palpitations, but watch the dosage. The side effects are worse. Well, the side effects are that your heart goes into a seizure or fibrillation and you die. Did you hear what I said? You die. D-I-E, die. That's a pretty bad outcome from taking magnesium.
Actually, it could help cause a total slowdown of heart.
That's right. Yes, sirree. And that's what people need to understand. that there's an envelope of safety. So let's go to the next one here. Now this, I don't mean to scare anybody, but this particular thing is supposed to show you some of the complications or the places where things like magnesium work. If you'll notice that this is a cell here, and where it says MGATP, DNA, signal transduction, messenger RNA, DNA duplication, protein synthesis, and mitosis, that's everything that has to do with the cell working. And magnesium is needed in there in the proper amount, okay? And if you got too much of it, you screw this thing up, and if you got too little of it, you screw the thing up. But we'll get rid of that one because that scares everybody. Just don't put any of them up for a minute. How many people do you know that have ever been diagnosed with low magnesium? None. How many of you know, Josh, ever been diagnosed with low magnesium? None. You know a lot of people that have had low sodium. Who are they? That's the guys been working out there all day in the hot sun, didn't drink enough water or just drank water, didn't get Gatorade or chicken soup, and their sodium fell. So a lot of people get low sodium. It's people you get low potassium. Who's that got low potassium? That was the one who drank too much water, or they're taking their diuretic with their blood pressure medicine, and they're not eating any bananas or eating or drinking orange juice or eating tomatoes. But you don't ever hear anybody who's normal out there in the world with a low magnesium. Low magnesium comes in our cancer treatments because those drugs I just showed you for testicular cancer that you take 3 times in 9 weeks, one of those drugs can lower your potassium. But in 9 weeks, it doesn't have a chance to lower it very much. Okay, go to that next one here. It begins at the top by saying, should I take magnesium supplement? And Josh reminded me this morning that a lot of people are watching this on a phone or on a tablet and they can't read it. So I'm just going to quickly stick it off to the side where people can see me. But this is where magnesium generally comes from in your diet. And if you look, the amounts are really high. Pumpkin seeds, I don't know how many people eat pumpkin seeds or Brazil nuts, but you get the common stuff like almonds, salmon, spinach, brown rice, black-eyed peas. This is the South. We got tons of black-eyed peas. Potato salad, like we had the other night with the skin on it. Look at that. So all of these things, we can take that down now, Josh, are natural sources of magnesium. So what I would tell this patient is your friend may not, tell your friend you really appreciate the advice, eat you some nuts and salmon, but I would not go buy a magnesium supplement and take extra magnesium unless, we've said before, you're a female. This age is perfect because this female's 49. She should be on calcium supplementation. So if you're taking calcium supplementation at 49, you're trying to keep your bones up, we've said before that amounts 1,000 milligrams. It ought to have a little vitamin D in it so the calcium can work. And they will have a calcium magnesium supplement that's cheap as dirt and a lot cheaper than buying a pure magnesium supplement, and it'll be in an amount that if you take the right amount of calcium, there's not going to be too much magnesium. In other words, it's balanced out,
right.
Okay? So let's go to that last one, and then we're going to quit worrying about magnesium. So what it says at the top, what if we consume too much magnesium? And it begins by saying, really, really big, there's no toxicity from
magnesium in food.
No toxicity from magnesium in food. And the next one say magnesium supplements can cause diarrhea, nausea, cramps, dehydration, and can make your heart go into a seizure and die. So I think that's enough. We don't want to discourage taking enough magnesium in your calcium supplement or eating the right foods, but we want to discourage taking magnesium by itself unless there is a specific reason that Dr. Tidman or your doctor gave you. Now I'm going to go back to this question because there's a couple other things in there. I'm taking vitamin E. Well, we've talked here before. We have now just figured there is no advantage to taking vitamin E supplementation to anybody who eats a normal type diet. And there is hazard that you take vitamin E, it can make you bleed. So that's why when they say you're going to have a colonoscopy, or you're going to go have a facelift, or you're going to the dermatologist and have a mole removed, do not take vitamin E for at least a week before the surgery, or you might bleed. So a hypertensive person, if their high blood pressure is not well controlled, vitamin E could increase the chance that they could bleed into their head. Now, fish oil, we've said before, there ain't nothing wrong with fish oil except it tastes lousy, and it's a lot better to eat the salmon and the tuna, but fish oil in reasonable amounts are not going to hurt the blood pressure control or anything else. And cod liver oil tastes like crazy too, and I don't know why they'd want to taste that, because when I was a kid and your grandparents were trying to punish you, you know, and then you were being sick, they'd give you cod liver oil. I didn't think that was a good thing, but a little bit of cod liver oil is not going to help you either. But I would recommend no vitamin E. I'd recommend eating the fish, and cod is a fish, but I don't care if she takes those two.
Well, it sounds like to me, and I don't know, so I don't want to get into supplements or get that discussion going, but it sounds like to me that most of the supplements you want to take, you actually could do that through your diet. You could change your diet and get the supplements that you feel you need. Am I wrong?
No, you're right, except I do think it's important for women over age 40 to take calcium, because it's hard to get that much in cottage cheese and milk and everything else.
I get it.
Without getting a bunch of calories.
Right, that's why I said I didn't want to get into it, because there are calcium, supplements.
Yeah, that's one we're not going to argue with.
Right, but
with a little D in it. Yeah.
But for the most part, if you balance your diet, a lot of those supplements can be in there. And
better to eat a good diet than it is to go to the health food store and take a handful of pills and think it's going to make you thin, good looking, rich, and healthy. How about that?
There's only two people let's see, what I don't want to say trust, but that come to mind is Dr. Bob, and I can't explain to you who Dr. Bob is right now. And
Dr. Bob Coles, I know.
Dr. Bob, I'm not going to go there right now. And for those, Jacqueline.
Oh,
I know I went there, right?
Yeah. Oh, boy, that's like what's that guy's name? Kicking the sand out of your face.
Absolutely, old Jacqueline.
Yeah,
well, always we want to thank Georgia Cancer Research Center right here in North Georgia, because if you go on their website, Northside Hospital, and you look, they have centers all over the state. You got places all over the state. We are in North Georgia. We appreciate them supporting and sponsoring this segment. Okay, so let's close out. What do you have for our audience? And before we go, maybe you could tell us some of the young people we're going to meet.
All right. Well, you're going to see two young men today. You're going to see a lean field goal kicker who you watched kick, I think.
I did. I sure did.
Who's one of the top kicking prospects in the country. And then you're going to see his younger brother, who is consumed with history and politics. He reads. He read Unbroken. He read Defeating the Rising Sun by Bill O'Reilly. I think he's read every Bill O'Reilly book for fun as a 10, 11, and 12-year-old. So I think you're going to have some politically astute, not bashful commenters that are young. It'll be fun for you.
We're looking forward to it. Is there anything you want to close with?
Two things, because we always have to. We got these people here who think we're poisoning ourselves with these. So, two things were in the news this week. Sugary drinks that have sugar in them have now been linked to an increase, look at this, increase in cancer risk. If you drink sugary drinks one a day, it'll increase your chances of having cancer of any type by 20% and breast cancer by 28%. Now, is that the sugar, or is that the calories and the resulting obesity? You remember every time we've discussed these things, obesity, lack of exercise are always a risk factor. But it looks like the degree of risk may be higher than just the degree of risk that you can hit with obesity. So that's at least some encouragement for us to be allowed to drink these drinks here and not have our expert panels tell us we're killing ourselves. Now, the last one, which is really kind of interesting, is what is the most common way to cook food in America, Josh? Fried. There you go. Fried. You got it. You hit it on the head. If you eat 3 fried dishes per week, you increase your chances of cancer by 7%. If you stop and look at diets, many people have fried foods every day. If you eat fried foods every day, you raise your risk of cancer by 14%. Now, that's not that Japanese hibachi thing, where you have increase in cancer, increase in stomach cancer. And the exact mechanism of that's not terribly clear, except it's probably the same change in the chemical composition of the fat that gives it some of that cancer-causing and cancer-provoking potential. Now, that's pretty good, isn't it?
Sure.
So you can drink your diet drinks and quit eating so much French fries.
No.
Oh, now, even fried okra.
You went from preaching to meddling when you got on French fries,
and they got on fried okra. You mentioned fried okra in there, and I had big old fried okras the other night.
Don't forget fried okra. We're in the South, friend.
Yeah,
I'm
meddling.
Can't lose our Southern viewers now.
I'm quit meddling.
Fried okra, you don't touch that. Thank you very much, Dr. Whaley and Northside Hospital Cancer Research, North Georgia Cancer Research. Folks, if you have a question for the doctor, you send that to info, I-N-F-O, at fetchernews.com and put in the subject line, Ask the Doc. Also, follow us on social media, Fetcher News on Facebook, Instagram, and you will see Ask the Doc throughout the week. If you have a question, you can put it on there. We'll try to find it on our social media. We keep up with that. So, always, the more detail, age, men, women, all the detail you can, helps the doctor answer the question, Ask the Doc. And also, if you'd like to share this with your friends, you can go to our YouTube channel, Fetch Your News, FYN TV. Look at the playlist, Ask the Doc, and you can share all of these segments with your friends. Great information.
And you're going to have a relief pitcher in here a couple of times in the next month, remember, because I'm going to Russia and things, and Ray will be in here a couple of times, and you may get Justin Nicholson in here a time or two, but they're going to be good.
I read an email that said, I'm off to Russia.
Yeah.
Okay.
All
so
right.
Yes, that's in
relief pitcher.
No collusion intended.
No collusion intended. Yeah. Hey, wait a minute. What? We got to go. Hey, folks, right on the other side of this commercial break, it's time for the All-Star Political Panel. As the doctor has told you, we have a couple young people that are going to be in this morning. We're excited about that. And wonder if there's anything going on this week, as I always say, that we want to talk about. All-Star Political Panel right after these commercials.